Hello, everybody. It's Dr. Hammerstedt from Holist. I'm really excited to have Dr. Breanne Fox here from Renew Manual Physical Therapy. Hi, Bree.
Hi guys.
So we had some technical difficulties on Facebook. So sorry if you guys tried to watch a couple of times. We are here now, and I'm really excited to introduce you guys to Bree. She's a new expert for us today here at Holist. She's going to drop some pearls on us for some out of the conventional box approach for women's health and growth. She is a doctor of physical therapy with specialty focuses on pelvic floor rehabilitation and health, visceral and neural manipulation, and myofascial release and strain. And so she does urogynecologic, pelvic, visceral, and sexual health and wellness. And this encompasses a ton of things for us to learn. And so first, I just want to, have you introduce yourself, talk to us about, what you love about what you do and how you got where you are. And then we're going to get into some bladder tips.
All right, sounds good. Well, first of all, thank you for having me. And it is such an honor to be a part of this Facebook Live and to join with Holist Health. So thank you guys for being here, whether you're catching the replay or you're here live. So thank you. So as she said, my name is Dr. Breanne Fox. I'm a doctor of physical therapy, and that is my license, but I do something a little bit different. And that is that I focus on organ, bowel, bladder, sexual dysfunction. And so talking about bladder, talking about pooping, talking about sex, those are all within my daily conversations. And so what I've learned is that a lot of patients, they just don't know. And when they first come in, the comment I hear a lot is, whoa, like I didn't even know this existed. And so I'm hoping by being here with Holist Health today that I can at least give you guys some of the pearls and then just allow you to know that there's help out there if you're having, like we're talking about today, bladder problems. So I just love that I get to do something different and that I get to tap into the market where people haven't had that education. They don't understand what to do different. Therefore, they don't, if you don't know, you don't know, right? And so being in the position that I'm in, I'm able to educate, and I love that aspect of what I do.
So talk to us about what is different about what you do from, regular, first of all, I didn't know that pelvic physical therapy existed, and I'm a doctor, right? I mean, I went to one after my first child was born, and was really blown away by what she was doing in pretty conventional pelvic physical therapy. So talk to us a little bit at kind of what that conventional approach is and what you do that's a little bit different.
Absolutely. So the conventional approach, which all my training is through Herman and Wallace, it's an pelvic rehab institute. And what we do is we look at the pelvic floor and the pelvis and look at the dysfunction that might be happening that could be causing any kind of issue. So sexual dysfunction being a big one, bladder prolapse, which is where the bladder is actually descending towards the vaginal opening. Incontinence is a really big one. Constipation, bowel issues. And so in that conventional type of therapy, we work with patients internally as well as externally to try and restore that function within the pelvis. And then where I am different is I have that formal conventional training, but then being introduced to the Baral Institute and visceral and neural manipulation has just been a game changer, not only professionally, but in my personal life as well. And what that means is that I'm able to look at the body in a more holistic way, head to toe. We have a very, very profound way of assessing the body to say, what is the driver? So what is actually causing this prolapse or incontinence?
God forbid we try to find the cause, right?
Right. Whereas often we just automatically think it's pelvic floor dysfunction or weakness that's causing leaking. But clinically, what I've seen is that more often than not, it is actually something coming up from above. So it could be pressure systems within this pressure system changes within your system that are pushing down, not allowing that pelvic floor to do its job. So yes, it's weak, but what's causing it to be weak? And if I just have you sit and do a bunch of Kegels and they're not helping, it's probably because there's something else going on. And so in the work that I do, I'm able to assess the body in a holistic, more alternative way to say what's driving this. And it could be literally something coming from as high as the head to abdominal issues to anything. So
Really
it's been
interesting.
great to have that tool.
Yeah, that's great. So we're going to talk a little bit today about bladder health. You are part of our women's health program here at Holist, and we've had about, I think, 9 different interviews with you in the past. So I know that we could talk forever, the two of us, about all of this stuff. But we'll just choose the bladder today and kind of stick to that. And so I'll give a little bit of an overview, and then I'd like to hear some of your tips about bladder health. So basic anatomy, basically, so the bladder is a membranous hollow sac in the low pelvis, right in the low, kind of above your pubic bone. You put your hands down there, you can sort of feel that the whole, kind of the whole opening of the females to the outside is the vulva, and this encompasses the exits of the bladder with the urethra and the uterus with the vagina. So above there, the pubic symphysis is there, kind of seaming that pelvic pretzel together. And bladder is kind of right down in there. And so don't push too hard on it, but it's right down there. So then attached to the bladder, we have those ureters that go up to the back to where the kidneys are. And the kidneys filter the blood microscopically through those little tunnels down to the bladder, and it pools in there until you're ready to empty it through the urethra. So then that's where we are now, right? We got a bunch of pee in there and we're waiting for it to come out. People have trouble emptying completely. They have trouble with leaking and incontinence. So give us like kind of your key to bladder health for us today.
Sure. So I think the biggest thing that clients don't understand is that you have to drink water. And I think what happens is when we get into that phase where we're starting to have leaking, or we have pressure, or we're too busy, or whatever the case may be, we start to limit water. And water is the most important thing. So I just want you guys to understand that when we talk about bladder health, I talk about it from like an optimal health standpoint, meaning that we want to get the entire environment healthy. So that's bowel, that's bladder, and that's pelvic floor, because those have an inverse relationship with one another. And so if one of those 3 things is acting up or dysfunctional, or whatever word you want to use, it can create havoc in that entire environment. So when I talk about water, I want you guys to know that the minimum should be half your body weight in ounces per day. And what often happens is you go, oh my goodness, like I'm only drinking 24 ounces a day and I already feel like I pee, every hour or whatever it might be, or I already leak. So if I add in more water, I'm going to leak more. And what I want you guys to understand is that when the bladder is in that healthy environment, water being one of the biggest things for that your bladder will actually act in a more functional way. So that would be your concentration of urine is at a higher concentration when you're dehydrated. So in that higher concentration of urine, it's going to be more disturbing to the bladder. It's going to create an urgency effect where literally you're like, I got to go, and you run to the bathroom, and then you sit down, and maybe you only have trickle 1, trickle 2, trickle 3. Mm-hmm. Your bladder was not full enough to need to go. That's more of an urgency, and that urgency can be created from irritants, which one of those irritants is dehydration. So I just want that to literally, if you hear nothing else, this entire Facebook Live, know that water is very important.
Yeah. And it's a habit. I mean, some people are good at drinking that amount of water and some people are terrible. And I have, my habit at work is much better than my habit at home. And, it's like, you just have to kind of work at it. 3 months to make a habit. So
it's tough. Yeah.
Yeah. So talk a little bit more about irritants, and then maybe we'll get into incontinence, because that's a big issue for a lot of women.
Okay. So irritants. So a lot of the number one is going to be dehydration. Then we look at things like alcohol. We look at citrus, caffeine, carbonated beverages, spicy foods. Vinegar-based products tend to be irritating to the bladder, as well as tomato-based products. So those are some of the big ones. And what I'll tell my clients is, you do not need to take all of these out of your diet. That's I am here to educate you and allow you to make choices to say, okay, I'm going to go to this amazing Italian restaurant for my anniversary dinner, and I'm going to have a glass of wine, and I'm going to have, tomato-based product in my pasta, and I'm going to have some vinegar on my salad. But that night, maybe I urinate 6 times before I go to bed, or maybe I wake up in the middle of the night a couple, 2, 3 times. None of those things are normal. So in that case, if you make that choice to have that meal, that's okay. But just know that your bladder habits following that are temporary, and that as long as overall you have a good, healthy environment, that one, you're going to be able to tolerate those splurges or those irritants a little bit better, but that you'll understand why your bladder is acting that way, and you can make the choice. The big thing is we don't want the bladder to control us. We want to know how the bladder works, and then that way we can control the bladder.
Yeah. And I mean, and then in that situation, right, then you're going to want to make sure that you're drinking enough water so that you're kind of, you know, literally watering down the irritants.
Look at it like that, because it really, the more hydrated you are and the healthier that environment, the better tolerance it has to those irritants coming in. So if you know you're going out to dinner and you're going to splurge a little bit, just make sure you're hydrated. That's a really big way to offset that.
Yeah, that's great. Great. So what about incontinence?
Incontinence, this is a big one, and we really could talk for days on this. So I think some of the big points for those of you who are experiencing leaking, I want you to, one, know that it is common. You're not alone, but it is not normal. You do not have to live like that. And there are so many different views as far as, well, I've had 3 kids, or, you know, I've been incontinent since my first baby, and this is just, you know, I'm having children, so this is how I have to live, or I'm over the age of 55 and I've been through menopause and this is just normal now. And I want you to know that it is not normal. So if there is any kind of leaking, whether you're 24 or you're 54 or you're 84, it is not normal. And that just goes to show that there's a dysfunction in that system.
Mm-hmm.
It's not a badge of honor, and it's not something you have to live with. There are pelvic floor specialists out there that work specifically with incontinence. The second piece that I want you guys to take home is that 87% of the population that actually performs Kegels on a regular basis, and Kegels are the contraction of your pelvic floor muscles. I think everybody probably has heard of a Kegel, whether they know what that means or not, but
we're all doing them right now because you said it.
So it's basically strengthening your pelvic floor muscles, and 87% of folks that are doing them incorrectly. So if you're on a Kegel regimen and you're not improving and you're leaking and you're not seeing a change, it could be that either one, you're unable to isolate those muscles appropriately for that true strengthening, or there's something else going on. And that's where doing a little something different comes into play. Is maybe it is a pressure system issue, or maybe it's something coming through your abdominal content and pressure coming down. And so if you're doing Kegels regularly and they're not improving your symptoms, then you probably need to have somebody further assess you.
Yeah. And it's interesting because I remember from when I went, they had like little like electrodes sort of that they can like see which muscles you're actually contracting when you're doing the Kegels. And so that's kind of what you're getting at, is that you can go in and be assessed by someone, not just, you know, you should do them this way, but like actually they can show you, you know, how you're doing it and how strong you're doing it. It's really interesting stuff.
Yeah, that's called biofeedback. And that is really a very intimate way for one person to truly understand. You know, it's like, I know how to bend my finger here, right? That we naturally can do that. But the pelvic floor isn't one of those things that we just naturally contract, that we're aware of in a lot of cases. And so just really learning what this looks like,
yeah,
but down there, right?
Right, because otherwise you're like, just do this.
And the problem is if we bear down, we're actually, so someone who holds their breath or does bearing down, they're not going to get that proper contraction. So it really is a matter of taking out all the accessory muscles. We're not contracting the glutes. We're not squeezing our legs. We are literally isolating the pelvic floor muscles and working on strengthening them so that they can do their job.
Yeah, awesome. Any other tips for us?
On incontinence specifically?
Anything.
I think one of the big things, if a little off incontinence, but this could be part of it, is that what I find is that a lot of women that come into the clinic, they just have really poor bladder habits, and it can start. I have a lot of reasons of why that can start. If we've had a baby, sometimes it starts within that breastfeeding period or that constant wake period in the infancy stage where we're up every 2 hours or every hour with the baby. And so especially at night where we wake up and we feed the baby, so then we go to the bathroom, feed the baby, go to the bathroom, and we create these habits. And a lot of it is habits. And what I like to teach my clients is that we can change those habits as long as we know what the proper thing to do is. And so rushing when you're on the toilet, so moms, right, or someone at work, school teachers might be the worst with this because they have 5 seconds to go to the bathroom. So they rush there, they sit down, they urinate, and they rush back. Well, the problem is we're not often fully emptying the bladder, and we're staying in kind of a hypertonic or spasmodic state of that pelvic floor. And so the bladder can't truly do its job. And in that, we don't fully empty. So then we find that we're going more frequently. Whereas if we would just really take that extra 5 or 6 seconds, take a deep breath on the toilet, which is so important to allow everything to relax, pelvic floor included. So mechanically, the bowel and bladder can do their job. They can fully empty. If we just take that little extra time, take a few deep breaths, make sure we're completely empty, it's going to save us a couple trips throughout the day.
Yeah.
Creating good, healthy habits is really important.
Yeah, I mean, I talk so much with our, holist clients and patients about mindfulness. And in a way, that's what you're talking about, right? It's like being in the moment when you're doing something like urinating.
Right.
It's like ridiculous to talk about, but that is what it is. It's giving yourself that moment to really be there, really get everything out, and then move on to what you're trying to move on to. Yeah.
And then one thing we haven't touched on that I would like to make sure everybody knows is that typical bladder, very healthy functioning bladder, should be able to urinate every 2.5 to 3 hours, despite how much water you're drinking. Now, let's assume you're drinking half your body weight in ounces as a minimum, but consistently throughout the day. So if I go and I drink 64 ounces of water at 3 o'clock in the afternoon, that might throw me off. But if I'm drinking water throughout the day and I have a good, healthy environment, I should be able to wait 2.5 to 3 hours. Anything less than 2 hours, your bladder is technically not full enough to need to go. It's probably just more of a signal of urgency based on an irritation, or it's a habit. So we get back into that mindfulness. So you can really pay attention to, why am I choosing to go at this time, and how long has it been since I went last? And then anything over 4 hours really isn't healthy either. We're stressing the bladder wall at that time. We're stressing that detrusor.
I'm bad at that at work, that's for sure.
Yes. So those of us that work in school, teachers, nurses, doctors, physical therapists, where we're patient to patient, student to student, it really can become an issue where we have to really focus and say, okay, what are my breaks throughout the day? And can I put myself on a consistent schedule, just like I would if I was potty training a puppy or a baby, right?
Yeah.
And we can do that no matter how old or young we are, in order to change what our body is doing and help it function in a healthy way.
And you call it retraining the bladder.
Yes.
Yeah. Awesome. That's really great. Well, I'm always so happy to talk to you, and lovely to have it on a live today so everyone else can enjoy you as well. The Holist Women's Program is going to be ready in the winter time, although it is winter already here in Idaho. We got a bunch of snow on the ground, as well as our fitness program. And happy to be able to share you with our clients in that way as well. So
thank you. And thank you guys for listening to all the education that I have.
Yeah. Take care.
Bye.